On this episode, we'll talk about the C-pap machine after surgery. We'll talk about what diet to follow after surgery, high protein, low carb, and we'll talk about vitamins and supplements. Should we take them all together or should we split them out throughout the day? Hello everyone, I'm Dr. Alvarez and welcome to episode 19 of the Ask Dr. A show. Glad to be here. It's been a busy week and we are getting a lot of questions using the hashtag AskDrA. So if you have any questions, don't forget to use the hashtag on Twitter, Facebook, Instagram, or YouTube. That way my team can pick up those questions and we'll take them to the show. All right, so let's jump into the show then.
When can we use a C-pap without the fear of swallowing air and blowing out stitches?
All right, so this is more a myth than anything else, all right? There's no scientific studies, there's nothing regarding using a C-pap machine. People who have sleep apnea, they use a C-pap machine that will pump air into your recently done sleeve and blow it up. That does not happen. We do surgeries on a lot of people who have sleep apnea, on a lot of people who use C-pap machine or the BPAP machine. And let me tell you a little bit about these machines. These machines are automatic. They're very automatic that sense the breathing cycle of the patient. They will not push extra air in or less air in. They will follow the breathing pattern of the patient so that air goes directly to the lungs while you're breathing while you're asleep. There's no way that this air will go directly to your sleeve. It will pump a lot of air into it and blow it up. All right, so that's more a myth of it than anything else. If you do use a CPAP machine, it's because you do need it, so use it. All right.
Is a low-carb, high-protein the only diet recommended after sleeve surgery, or are there other diets to follow once you've reached goal?
All right, we're jumping into touchy subjects here. So what diet do you recommend after the sleeve? I push my patients to do a low-carb diet, high in protein, because there's not much space in that sleeve and some protein is good. But I push that diet on my patients because it's the easiest way for my patients to do this. If I tell them, all right, forget about the protein, just focus on eating healthy, cut the junk food out, focus on a lot of leafy products, focus on a lot of vegetables, focus on a lot of fruits, vast majority of my patients will not follow that diet. So the easiest way I've come up with that patients do well is lowering their carb consumption and keeping it on a good amount of protein per day. Now, a good amount of protein per day does not mean I want you drinking shakes all day long or supplements all day long. Please focus on just healthy food. After 3 or 4 months, drop the shakes, drop the supplements. I don't want them, I don't need them, because you're eating. And your protein will come from what you eat. You will not have a deficiency in protein, believe me. All right. So I would recommend that if you are dedicated, if you are concentrated on a certain diet, I would focus on a more green vegetable fruit diet and drop all the junk food and don't worry about the protein. versus going very drastic on a low carb, high protein. But if that works for you, that's good. I just don't want you eating the crappy food, the junk food, etc. Make wise decisions, all right? Take advantage of that golden year, those first 12 to 18 months, all right? Because that habit that you grab those first few months to a year, you're going to stick to that pattern. So take and make the most out of it.
Do you recommend taking all vitamins and supplements all at once, or split them out throughout the day?
Of course, that patient that is asking that question is not my patient, but I will explain. My patients know this. Taking vitamins and supplements all at once is a no-no right away. You can do this down the road, but the first 6 months, space them out in between, space out your multivitamin, space out your calcium, space out your iron, all right, B12. Don't take everything together. You have a brand new stomach, tiny stomach that needs to be taken care of. I don't want you stacking up the medications in that sleeve that will get it irritated or upset. All right, so space it out at least 30-45 minutes in between, or spread it out morning and evening. So that's it for episode 19 of the Ask Dr. A show. Thank you so much. Don't forget to subscribe. One bing, all right? One bing. One bing. Bing. All right? So don't forget to subscribe to your channel, and that way you don't miss any other future videos. I'm Dr. Alvarez from Endobariatric.com, and question of the show: do you take 2 or more medications at the same time? Do you? And how far out from surgery are you? Comments down here. Look forward to hearing from you. I'm Dr. Alvarez. We'll see you in the next episode.